So we take it for granted in this country and in countries which provide national health services that people can use healthcare according to their needs, their health needs, as opposed to their income levels. That is not the case in many parts of the world.
While many health ministries are moving forward with the universal health coverage agenda, so trying to negotiate this difficult trade-off between improving services and cost-efficient financing approaches is very important.
Because without finance, it's difficult to deliver on health. And looking at fiscal space analysis and seeing how important it is for us and seeing how it will help us to deliver more health for even the available resources that we have, I think it is very, very important.
So OPM Health Team has assisted governments at various stages towards advancing to pursue universal health coverage. And we have been doing that, for example, by helping governments devise health financing strategies to that effect.
So we're looking at what are the needs, projecting forward the health needs of a country, and also looking at the different sources of resources and how we can maximise those to close the gap.
So we've carried out fiscal space studies and costing studies in the frame of universal health coverage in about 40 countries.
So there are substantial barriers to increasing fiscal space, and the political dimensions are very important. The context, there can be a right context or a wrong context to do this kind of work.
Secondly, also, ministries of health, when they plan, most of the time they do not do it in conjunction with the Ministry of Finance. So Ministry of Finance doesn't know or doesn't feel this need. And as a result, when these budgets are created and sent to Ministry of Finance gives only what it has or what it thinks it has. And because of that, the huge gap always remains.
So it's really important when you come into a country and you've been asked to support the progress to universal health coverage is to map out the positions of the different stakeholders and to really understand where they stand, what their positions are, and what the difficulties are in working together to achieve universal health coverage.
The way we thought about the event was as a broad learning experience.
So this type of workshop helps to bring colleagues together from different places and just share experiences and share methodologies and guide them on their way forward.
Well, I hope these events can sort of build a community or build further a community of practitioners, of researchers, of consultants, of policymakers to come together in what is probably a neutral environment in which we can honestly, openly and robustly discuss what are the real problems we encounter in doing our work in supporting ministries to achieve universal health coverage.
So building capacity, building relationships, building understanding, helping countries to learn from one another. I mean, those are just some of the outcomes which we hope will be created by our work.